One way of getting an important message across is through laughter. In this Médecins Sans Frontières hospital, clowns work alongside medical staff to help educate patients about hygiene. Following the earthquake and the immediate aftermath, MSF ramped up its efforts to care for the wounded. In addition to surgery, it set up specialized post-operative care, such as physical therapy, psychological care, and plastic surgery. Lisha Mwenye is a plastic surgeon. She's getting ready to operate on this woman.
When she arrived, she had a skull fracture with bone loss, as well as a scar holding back her eyelid. Close your eyes. She can't close her eye, which is A, very annoying for her, and B, can cause other eye complications.
More than 50,000 people have already been treated by MSF medical teams, but the patients, once cured, have nowhere to go.
Another provisional solution that we're setting up is to give the patients a kit when they leave, which includes a mosquito net, a tent, soap, and kitchen utensils. Really, it's a part of the post-op, us saying, go ahead, you're in control. Here are the means, and it's to you to find a place to set up your tent. So it's a kind of therapeutic prescription for when they leave the hospital, but instead of prescribing medication, we're prescribing tents and soap.
This may not seem to be much, but it allows the Haitians to take control of their lives. In Port-au-Prince, hundreds of thousands of people are living in difficult conditions, conditions that have become even more difficult since the beginning of the rainy season.
When it rains, we can't sleep. We stay standing. Water comes in through the top and from the ground as well. If it continues, we won't be able to stay here. It simply rains too hard. It's the cyclone season.
MSF has begun the distribution of 26,000 tents, which should provide shelter for about 100,000 people. The lack of sanitation facilities makes the situation even worse for those in the camps. There's also a lack of security, which has led to various problems, including a very high rate of sexual assault. Roofs and walls made of branches and plastic sheeting. These families fled fighting and bloodshed back home in Somalia, finding themselves refugees in the northeast of Kenya. In 3 camps surrounding the town of Dadaab, they struggle to get by. For the past year, MSF has been providing them with health care.
The health services that we provide include curative, preventative and nutritional activities. MSF Switzerland is also in charge of medical and nutritional screening plus vaccination of all new arrivals for all 3 camps in the Dadaab area.
In 2009, MSF medical teams treated 60,000 patients from the Dagahale camp, of which 2,200 were children suffering from malnutrition. MSF has also set up a mental health care project to help the particularly large number of people traumatized by both war and exile.
During the last 12 months, we have seen some improvement in the conditions for the refugees in terms of healthcare provided, education and shelter. However, overcrowding is at the core of the problems that the refugees face, with the population of 270,000 living in camps that were meant to accommodate 90,000.
In addition to the problems caused by overcrowding, the refugees in Dadaab suffer from a severe lack of the basic necessities. They only receive 15 litres of water a day, and they often go hungry. The camps, built in the 1990s, are quite simply unable to meet the basic needs of the Somali refugees. At the end of January, the MSF hospital at Menik Farm in Sri Lanka was closed. During the 8 months of medical activity in this facility, 4,000 patients were hospitalised. Amongst them were this woman and her son. The mother had shrapnel embedded in her leg. The boy complained of pain in his shoulder. This is the Vani region in northern Sri Lanka. The MSF field hospital was set up last May, when tens of thousands of people fled the fighting between the Tamil Tigers and the army. More than 280,000 people spent months in the camps in Menik Farm, where Ministry of Health teams identified the injured and referred them to different hospitals, including that run by MSF.
I guess most of them have been like medical emergency. People with fevers of unknown origin that have been severely dehydrated and often have had a lowered level of consciousness due to overwhelming infection. So that is probably the main cases from the camps. Other than that, we have had some trauma cases.
I will need some salad.
Many patients presented infected shrapnel or gunshot wounds, requiring several medical interventions. In addition to those hospitalized, approximately 13,000 outpatient consultations were provided. This child is suffering from malnutrition. Others in the hospital at Koutiala have malaria or measles. In this region 250 kilometers east of Bamako, 1 in every 4 children dies before the age of 5. In July 2009, MSF set up a paediatric project, which includes a nutrition program. The teams work in collaboration with the health minister and have set up a program of free healthcare for children under the age of 5.
The results we've seen so far are very encouraging. Often the number of people using healthcare services has increased tenfold, and the number of children screened for malnutrition has multiplied by 5.
Screening is carried out at one of the 5 communities. This one in Ntogonaso. First, the children are examined. If they're malnourished, they receive therapeutic food rations, and they come back to the centre each week until they are better. Children who need to be hospitalized are transferred to the nutrition centre in Koutiala.
We're in intensive care here where we treat the most severe cases. This child has kwashiorkor, a type of malnutrition that causes edemas. To reduce the swelling, we're giving the child therapeutic milk, but as you can see, he has skin lesions all over his body. Once his condition has stabilized, we'll transfer him to the intermediate phase.
In total, more than 2,000 children were hospitalized between July and December 2009, the main causes being malnutrition and malaria.
When we started the project, we knew we'd get a significant number of children, but we're seeing far more than we expected.
The MSF project in Koutiala is continuing in 2010 and is due to introduce preventive measures such as vaccination and the distribution of mosquito nets and ready-to-use supplementary food products. It was supposed to be a disease of the past. However, tuberculosis continues to claim lives. MSF teams witness this firsthand. From China to Armenia to Kenya, volunteers in the field contend with tuberculosis in numerous countries and in diverse socio-political settings: conflict, population displacement, urban environments and prisons. In 2009, the organization treated more than 30,000 patients suffering from tuberculosis, a disease which kills 2 million people each year. With International TB Day on the horizon, MSF attempts to revive the debate.
The research on all the aspects of tuberculosis, whether it's the diagnosis of tuberculosis or vaccine against tuberculosis or the treatment of tuberculosis, all these 3 aspects have been neglected over the last 40 years. I mean, the last real drug that was developed for tuberculosis was in the 1960s. The vaccine dates back more than 100 years and the diagnosis also.
A growing number of patients are developing a form of the disease resistant to the drugs available. As for the diagnostic methods, they are unable to provide reliable results in 2/3 of cases, mainly children or people infected with HIV.
In both of them, the symptoms can be quite generalized, so you have to think of TB to be able to diagnose TB in those patients. Once you've thought of TB, The diagnostic possibilities open to us are not adapted to either of those patients. In children, they can't produce sputum to have microscopy, and in HIV patients, often they have non-typical forms of tuberculosis, either extrapulmonary, outside of the lungs, or they're negative on microscopy, making it more difficult to diagnose them.
This means that screening can take weeks, a pace that is much too slow for the settings in which MSF intervenes. A faster and more effective diagnosis is essential, not only to treat the patients more rapidly, but also to reduce the risk of spreading.